Hey guys, welcome back to the channel. Today we're talking about a condition that I see way more often than most owners realize, and it's one that if it's not caught early, can actually lead to some pretty serious, even permanent damage to your dog's eyes. We're talking about dry eye, or as we call it in veterinary medicine, Keratoconjunctivitis Sicca, which we usually just shorten to KCS because, let's be honest, that's a mouthful to say every single time. If you've noticed your dog has thick, goopy discharge in their eyes that just won't go away, or their eyes look red and irritated all the time, or they seem to be squinting or rubbing at their face a lot, this video is really important for you to watch all the way through, because dry eye is one of those conditions that's very manageable if we catch it early, but can genuinely lead to blindness if it's left untreated. So let's get into exactly what's going on, why it happens, how we diagnose it, and what we can do about it. Let's start with the basics of what dry eye actually is. Your dog's eyes, just like ours, rely on a constant, healthy layer of tears to keep the surface of the eye, the cornea, and the conjunctiva lubricated, nourished, and protected. This tear film isn't just plain water, it's actually a pretty sophisticated three-layer structure. There's an oily outer layer that helps prevent the tears from evaporating too quickly, a watery middle layer that makes up the bulk of the tear volume and delivers oxygen and nutrients to the surface of the eye, and a mucus inner layer that helps the tears spread evenly and stick to the surface of the eye properly. When all three of these layers are working well together, the eye stays comfortable, clear, and well protected against infection and irritation. Keratoconjunctivitis sicca happens when there isn't enough of that watery aqueous layer being produced by the tear glands. And when I break down that name for you, it actually tells you exactly what's going on. Kerato refers to the cornea, conjunctiva refers to conjunctivitis, which is inflammation of the pink tissue surrounding the eye, and sicca simply means dry. So literally, the name translates to dry inflammation of the cornea and conjunctiva, which is a pretty accurate description of what we see clinically. When tear production drops significantly, the surface of the eye becomes chronically dry, which leads to irritation, inflammation, and if it goes on long enough without treatment, can actually cause damage to the cornea itself, leading to scarring, pigmentation, ulcers, and in severe prolonged cases, blindness. So this isn't just a cosmetic issue or a minor annoyance for your dog. Untreated dry eye is genuinely painful and can seriously compromise their vision over time. So what actually causes a dog's tear glands to stop producing enough tears? There are quite a few different underlying causes, and understanding which one is affecting your dog can actually be really important for guiding treatment. By far, the most common cause we see in general practice is immune-mediated disease. This is when the dog's own immune system, for reasons we don't fully understand, starts attacking the tear-producing glands themselves, mainly the lacrimal gland and the gland of the third eyelid, as though they were foreign tissue that needs to be destroyed. Over time, this immune attack damages and destroys the glandular tissue, and the gland simply can't produce adequate tears anymore. This immune-mediated form is actually thought to account for the vast majority of KCS cases in dogs, and it tends to be a progressive, lifelong condition that we manage rather than cure outright. Though, as I'll explain later, we do have some really effective ways of managing it. Certain breeds are much more predisposed to this immune-mediated form, and if you own one of these breeds, it's worth knowing that dry eye is something to keep an eye out for. Breeds like Cocker Spaniels, both American and English varieties, are probably the poster child for this condition. I see it in Cocker Spaniels more than almost any other breed. Other breeds that are commonly affected include West Highland White Terriers, Shih Tzus, Lhasa Apsos, Pugs, Bulldogs, both English and French, Boston Terriers, Pekingese, and Cavalier King Charles Spaniels. You'll notice a pattern here. A lot of these are brachycephalic or flat-faced breeds, and part of the reason they're more prone to dry eye isn't just genetics affecting the immune system, but also because their prominent, more exposed eyes mean the tear film evaporates more quickly and the eyes are more vulnerable to irritation and trauma in general. Beyond the immune-mediated cause, there are several other things that can lead to reduced tear production. Certain medications, particularly a class of drugs called sulfonamides, which are used to treat various infections, can sometimes suppress tear gland function as a side effect, and this is actually one of the more common drug-induced causes of KCS we see. If your dog is on one of these medications and develops dry eye symptoms, it's really important to let your vet know, because switching medications may resolve the problem. Certain systemic diseases can also play a role. Hypothyroidism, which is when the thyroid gland isn't producing enough thyroid hormone, has been associated with an increased risk of KCS in some dogs. And this is actually one of the reasons vets sometimes check thyroid levels when working up a dry eye case, especially in breeds prone to both conditions. Distemper virus, which I mentioned briefly in one of my earlier videos, can also cause damage to the tear glands as part of its broader effects on the body. So in some cases, particularly in dogs who had distemper as puppies, we see KCS as a lasting consequence of that infection. Trauma or previous eye surgery, particularly surgery involving the third eyelid gland, can also sometimes lead to KCS if the tear-producing tissue is damaged or removed in the process. This is actually part of why, when we're dealing with conditions like cherry eye, which is when that third eyelid gland prolapses out of position, we always try to surgically reposition and preserve that gland rather than simply removing it, precisely because removing it can significantly increase the risk of the dog developing dry eye later in life. There's also a congenital form of KCS where some dogs, particularly certain toy breeds, are simply born with underdeveloped or poorly functioning tear glands from the very start, meaning they show signs of dry eye from a young age rather than developing it later as an acquired condition. And then there's a less common but important cause called neurogenic KCS, which happens when there's an issue with the nerve supply to the tear gland rather than the gland itself being damaged. This can sometimes occur alongside other neurological signs, like an issue affecting the facial nerve, and it's something we consider particularly if a dog develops sudden dry eye alongside other neurological symptoms like facial drooping or difficulty blinking properly. Now let's talk about what dry eye actually looks like, because recognizing the signs early really can make a massive difference in how well we're able to manage this condition and protect your dog's vision long term. The most classic and telltale sign of KCS is a thick, ropey, mucoid discharge from the eyes. This isn't your typical watery discharge you might see with mild irritation or allergies. It's thick, sometimes yellowish or greenish, sticky, and it tends to accumulate quite persistently in the corners of the eyes and along the eyelid margins, often within just a short time of being cleaned away. A lot of owners describe it as looking almost like a thick paste or gunk that keeps coming back no matter how often they wipe it away. And that persistent, thick quality to the discharge is actually one of the biggest clues that points us towards KCS rather than a simple case of eye irritation or a minor infection. Redness of the conjunctiva, the pink tissue around the eye, is another really common sign. The eyes often look chronically bloodshot or inflamed, and this redness tends to be persistent rather than coming and going the way it might with something like a simple allergic reaction. Dogs with KCS often squint, or you might notice they're keeping the affected eye or eyes partially closed, because the chronic dryness and inflammation is genuinely uncomfortable and even painful for them. Some dogs will paw at their face or rub their eyes against furniture, carpet, or your leg, trying to relieve that itchy, gritty, uncomfortable sensation, kind of like how our eyes feel when we've been in a very dry, air-conditioned room for too long, except this discomfort for a dog with untreated KCS is constant and ongoing. If you look closely at the surface of the eye itself, particularly in more advanced or long-standing cases, you might notice the cornea looking dull, cloudy, or losing its normal glossy shine. This happens because without adequate tear film, the surface of the cornea becomes rough and irregular rather than smooth and clear. In more chronic, long-standing cases, you'll often see the development of what we call corneal pigmentation, where brownish or black pigment starts to spread across the surface of the eye. This is actually the eye's own attempt to protect itself from the chronic irritation. But the problem is, this pigmentation can spread to cover the central visual axis of the eye over time, which can significantly impair or even completely block vision if it's allowed to progress unchecked. This is honestly one of the most important reasons why early diagnosis and treatment of KCS really matters, because that pigmentation, once it's developed, is often permanent, even after we get the underlying dry eye well controlled. Some dogs with KCS also develop what we call corneal vascularization, meaning you can actually see small blood vessels growing across the surface of the cornea, which is another sign of the eye trying to respond to chronic inflammation and lack of proper lubrication. But again, this can interfere with normal clear vision if it progresses. In more severe or advanced cases, particularly if KCS has gone unrecognized and untreated for an extended period, dogs can develop corneal ulcers, which are essentially open sores on the surface of the eye. These are genuinely painful, and without adequate tear film to help protect and heal the surface, they can be slow to resolve, and sometimes even progress to more serious complications, including, in severe cases, perforation of the eye, which is a real emergency. This is really the worst-case scenario we're trying to prevent by catching and managing KCS properly. You might also notice recurrent eye infections in dogs with KCS because tears aren't just there for lubrication. They also contain antibacterial components and help physically flush away debris and potential pathogens from the surface of the eye. Without adequate tear production, the eye becomes much more vulnerable to bacterial infections taking hold, which is part of why dogs with KCS often seem to have one eye issue after another if the underlying dry eye isn't being properly addressed. One thing I really want to emphasize is that KCS most commonly affects both eyes, though it's not unusual for one eye to be more severely affected than the other, at least initially. It tends to develop gradually in most cases, particularly the immune-mediated form. So owners often don't notice the early signs because they're subtle at first, maybe just a little more discharge than usual, or the dog blinking a bit more than normal. And it's only as the condition progresses that the more obvious signs like thick discharge and red, uncomfortable-looking eyes really become apparent. So now let's talk about diagnosis, because this is actually one of the most straightforward and important parts of managing this condition, and it's something that can be done quite quickly in a standard vet visit. The primary diagnostic test we use for KCS is called the Schirmer tear test. And if you've ever had your dog's eyes checked for this, you'll probably remember it. It involves placing a thin strip of specialized test paper just inside the lower eyelid for about 60 seconds. This paper has a wicking action that measures how much tear fluid is produced during that time, and the results are measured in millimeters of wetting on the strip. In a healthy dog, we generally expect to see readings of around 15 millimeters or higher per minute. Readings between roughly 10 and 14 millimeters are usually considered borderline or suggestive of early or mild dry eye, and readings below 10 millimeters are generally considered diagnostic of significant KCS, with very low readings, sometimes under 5, indicating quite severe disease. This test is simple, quick, relatively inexpensive, and can be done right there in a standard consultation room, which is part of why I always recommend that any dog showing the kind of chronic eye discharge and irritation I described earlier gets this test done as part of a thorough eye examination, because it really does give us a clear, objective answer about what's going on with tear production. Beyond the Schirmer test, a full ophthalmic examination is really important too. We'll use a special stain called fluorescein, which highlights any areas of corneal damage or ulceration under a blue light, because as I mentioned, corneal ulcers are a real risk with untreated KCS, and we want to make sure we're not missing one, especially since treatment approaches can differ somewhat if there's an active ulcer present. We'll also examine the eye with magnification to assess the overall health of the cornea, look for any pigmentation, vascularization, or scarring that might already be present, and check the health of the surrounding structures like the eyelids and third eyelid. If we suspect an underlying systemic cause might be contributing, like hypothyroidism, we might recommend some additional blood work to check thyroid function and overall health, particularly in breeds where that association is more commonly seen, or if there are other symptoms present that might point towards a broader systemic issue. Now let's get into treatment, because this is really the part I know most of you watching are here for, especially if your own dog has just been diagnosed or you're worried they might have this condition. The good news, and I really want to emphasize this because a KCS diagnosis can sound scary, is that with consistent, appropriate treatment, the vast majority of dogs with KCS go on to live very comfortable lives with good vision. The key word there is consistent, because unlike some conditions where we treat for a set period and then stop, KCS, particularly the immune-mediated form, which is the most common type, typically requires lifelong management. It's very rarely something that gets fully cured in the sense of the tear glands returning to completely normal function on their own, but it absolutely can be very well controlled with the right treatment approach. The cornerstone of treatment for immune-mediated KCS is a class of medications that work by suppressing the immune system's attack on the tear glands, allowing them to recover function and start producing more tears naturally again. The two main medications we use for this are cyclosporine and tacrolimus, both applied as topical eye drops or ointments directly to the eye, usually needing to be given once or twice daily depending on the specific product and how your dog responds. These medications work really well for a large proportion of dogs, but I do want to set realistic expectations here. They don't work instantly. It typically takes anywhere from a few weeks up to a couple of months of consistent use before we start seeing a meaningful improvement in tear production on repeat Schirmer testing, and it can take even longer, sometimes several months, to see the full benefit. This is exactly why I always tell owners, please don't get discouraged and stop the medication after just a week or two, because you're not seeing dramatic improvement yet. Consistency really is key here, and stopping and starting treatment inconsistently tends to give much poorer results than sticking with it steadily, even when it feels like nothing is changing initially. In addition to these immune-modulating medications, we almost always use artificial tear supplements or tear replacement drops and gels, especially in the earlier stages of treatment while we're waiting for the cyclosporin or tacrolimus to start working, and sometimes as an ongoing addition even once the eye is better controlled. These come in various formulations. Some are more watery and need to be applied frequently throughout the day, while others are more gel-like or ointment-based and last longer between applications, which can be really helpful for dogs or owners where frequent dosing throughout the day just isn't practical. If there's a secondary bacterial infection present, which as I mentioned is quite common in dogs with KCS because the natural protective function of tears is compromised, we'll often prescribe a topical antibiotic eye medication for a period of time to clear that up alongside the other treatments. For dogs who have developed a corneal ulcer as a complication of their KCS, treatment becomes a bit more involved and requires very close monitoring because we need to manage both the underlying dry eye and actively treat the ulcer itself, often with more frequent medication application and follow-up visits to make sure the ulcer is healing properly and not progressing to something more serious. In cases where an underlying cause has been identified, like a medication side effect or hypothyroidism, addressing that underlying cause is obviously an important part of the treatment plan too. So this might mean switching to an alternative medication or starting appropriate thyroid hormone replacement therapy if hypothyroidism is confirmed to be a contributing factor. Now, I do want to talk about what happens in cases where medical management with cyclosporine or tacrolimus just isn't giving us adequate results. Because unfortunately, this does happen in a small percentage of dogs, sometimes because the immune-mediated damage to the glands is just too extensive for the medication to reverse enough tear production, or in some of those congenital cases where the tear-producing tissue was never properly developed to begin with. For these more challenging cases, there is a surgical option called parotid duct transposition. This is a pretty clever, if slightly unusual sounding, procedure where the surgeon actually redirects the duct from the parotid salivary gland so that instead of saliva draining into the mouth as it normally would, it's rerouted to drain into the eye instead. Now, I know that might sound a bit strange, using saliva to lubricate the eye, but saliva does actually share quite a few similar properties to tears in terms of its lubricating qualities, and this procedure can provide really significant ongoing lubrication for dogs whose own tear glands simply aren't going to recover adequate function through medication alone. It's not without its own considerations. Dogs who've had this procedure will sometimes have a bit of excess moisture or discharge on the face, particularly noticeable around mealtimes when salivation naturally increases due to the sight or smell of food, but for dogs with severe non-responsive KCS, this can be a really valuable option to preserve their comfort and vision long-term when other treatments haven't been sufficient. I also want to briefly mention that for some dogs with milder or borderline cases, sometimes a combination approach with just consistent artificial tears and close monitoring without necessarily needing the full immune-suppressing medications might be sufficient, particularly if the Schirmer test values are only mildly reduced rather than severely low. This really does need to be assessed on a case-by-case basis with your vet, taking into account how significant the reduction in tear production is, how the eye itself looks on examination, and how your individual dog is responding. Something I always emphasize to owners starting treatment for KCS is the importance of regular rechecks, particularly in the early stages of treatment. We'll typically want to see your dog back for repeat Schirmer testing and a thorough eye exam every few weeks initially to monitor how well the treatment is working, adjust the treatment plan if needed, and make sure we're not missing any developing complications like corneal ulcers or worsening pigmentation. Once things are well stabilized, these rechecks can usually become less frequent, but ongoing monitoring, even just every 6 months or so, once things are well controlled, really is important for a condition like this that requires lifelong management. I want to spend a bit of time talking about what long-term management and living with a dog who has KCS actually looks like day to day, because I think this is really valuable for owners who might be feeling a bit overwhelmed after a new diagnosis. Most dogs with well-managed KCS go on to live completely normal, happy lives. Once we get the medication routine established and the tear production improving, a lot of owners tell me they almost forget their dog even has the condition because it becomes just a normal part of the daily routine. Similar to how some people manage things like daily contact lens care or allergy medications without really thinking about it much after a while. The eye drops typically become a quick, routine part of the morning and evening schedule, and most dogs actually tolerate them really well once they're used to it. especially since the drops themselves tend to bring relief from that gritty, uncomfortable sensation they were likely experiencing before treatment started. I do want to mention a few practical tips that can make administering eye medications easier, because I know this can feel a bit daunting, especially if you've never had to give eye drops to a dog before. Approaching from behind or the side rather than head-on tends to be less startling for most dogs. Having a small treat ready immediately after application can help build a positive association over time. Keeping the medication at room temperature rather than putting cold drops directly onto the eye can also make the experience more comfortable for your dog. And honestly, with a little practice and patience, most owners get quite quick and confident at this within just a week or two of starting the routine. Regular cleaning of the discharge around the eyes. Using a warm, damp cloth or specific eye cleaning wipes designed for pets is also an important part of the daily care routine, particularly in the earlier stages before tear production has improved, because that thick discharge can be uncomfortable and can also contribute to skin irritation on the face and around the eyes if it's allowed to build up and dry there. I also want to touch on diet and general health support, because while there isn't a specific dietary cure for KCS, maintaining your dog's overall health, including good hydration, a balanced diet, and managing any other underlying health conditions well, all contribute to supporting their immune system and overall well-being, which can only help alongside the specific eye treatments. Something that comes up a lot in my clinic is owners asking whether they could have prevented this, and I really want to reassure you here, in the majority of cases, particularly the immune-mediated form, which, as I mentioned, is by far the most common cause, this simply isn't something that could have been prevented through anything you did or didn't do as an owner. It's largely driven by genetics and the individual dog's immune system, and while we can't prevent it from developing in predisposed breeds, what we absolutely can do is catch it early through regular veterinary checkups, especially in those higher risk breeds I mentioned earlier, and get treatment started as promptly as possible, because early intervention really does make a significant difference in the long-term outcome for your dog's eyes and vision. This actually leads me to a point I think is really important. If you own one of those higher risk breeds like a Cocker Spaniel, a Westie, a Pug, a Bulldog, a Shih Tzu, or any of the others I mentioned, it's really worth asking your vet to include a Schirmer tear test as part of your dog's regular annual health checkup, even before you notice any obvious symptoms. Because remember, this condition tends to develop gradually, and catching those early, subtle signs of reduced tear production before significant corneal damage or pigmentation has had a chance to develop can make a real difference in preserving your dog's vision long term. I do this proactively for a lot of my higher risk breed patients, and it's honestly caught quite a few early cases that owners hadn't even noticed yet, simply because the changes were still quite subtle at that point. I also want to address something else that comes up quite a bit, which is owners noticing their dog squinting or having eye discharge and wondering whether they should just try some over-the-counter eye drops or home remedies before coming in to see a vet. I really would caution against this, and here's why. There are actually quite a few different eye conditions in dogs that can present with somewhat similar-looking symptoms initially, including simple conjunctivitis, allergic reactions, foreign bodies stuck under the eyelid, corneal ulcers unrelated to KCS, and glaucoma, among others. Using the wrong type of eye medication or a human eye product that isn't appropriate for your dog's specific condition can sometimes make things worse rather than better, and can occasionally even mask or delay diagnosis of something more urgent, like glaucoma, which is genuinely a sight-threatening emergency that needs immediate treatment. So if your dog's eyes are showing any signs of persistent redness, discharge, squinting, or discomfort, it really is worth getting them properly examined by a vet rather than guessing at home, both to get the correct diagnosis and to make sure we're not missing something time-sensitive. I also think it's worth briefly addressing a related but distinct condition that sometimes gets confused with KCS, which is dry nose or nasal hyperkeratosis, because some owners assume if their dog has a dry nose alongside dry eyes, it must all be connected. While there can occasionally be some overlap, particularly with certain autoimmune conditions that can affect multiple areas of the body at once, dry nose on its own, without eye symptoms, is usually a separate and generally much less concerning issue, often just related to environmental factors, age, or simply that particular dog's normal skin characteristics. It's really the combination of those specific eye symptoms I described, thick discharge, redness, squinting, dull-looking cornea, that should prompt you to think specifically about KCS and get a proper eye exam done. Let's talk a little bit more about prognosis, because I think this is something that really weighs on owners' minds after a diagnosis like this. With consistent, appropriate treatment, the majority of dogs with KCS maintain good, functional vision throughout their lives, and their quality of life is genuinely very good. The main factors that influence long-term outcome are really how early the condition is caught and treatment started, how consistently the treatment plan is followed at home, and how severe the underlying tear deficiency is to begin with. Dogs who are diagnosed and start treatment while their Schirmer values are only mildly to moderately reduced, and before significant corneal changes like heavy pigmentation have developed, generally have the best long-term outcomes in terms of preserving normal, clear vision. For dogs who are diagnosed later, after more significant corneal changes have already occurred, we can still very often stop the progression and get the eye comfortable and well protected with appropriate treatment. But unfortunately, some of that existing pigmentation or scarring may be permanent, even though we've successfully controlled the underlying tear deficiency. This really is the key message I want you to take away. From this video, early recognition and early treatment genuinely does make a meaningful difference in the long-term outcome for your dog's vision, which is exactly why I get a bit passionate about encouraging owners, especially of those predisposed breeds, to not just wait and see if their dog develops obvious symptoms, but to be proactive about getting those regular eye checks done. I also want to briefly mention that while KCS is overwhelmingly a condition we see in dogs, it can occasionally occur in cats too, though it's considerably less common in our feline patients compared to dogs. The general principles of diagnosis and treatment are broadly similar, though if you have a cat showing similar symptoms, it's definitely still worth a proper veterinary evaluation, as the underlying causes and some treatment considerations can differ somewhat between the two species. One last thing I want to touch on before we wrap up is the emotional side of managing a chronic condition like this for both you and your dog. I know a diagnosis that requires lifelong daily medication can feel overwhelming at first, especially when you're already managing a busy life, but I really do want to reassure you that the vast majority of owners find that once the routine is established, managing KCS becomes a pretty seamless, quick part of daily life, taking just a minute or two twice a day, and the payoff, a comfortable, happy dog with good vision, is absolutely worth that small daily investment of time. I've had so many owners tell me that after starting treatment, they realized just how uncomfortable their dog had actually been before. Because once the eyes are properly lubricated and the inflammation settles down, dogs often become noticeably brighter, more comfortable, and more like themselves again, which really speaks to just how much that chronic dryness and irritation was affecting them, even if it wasn't always obvious day to day before treatment started. So to bring everything together, dry eye or Keratoconjunctivitis Sicca is a condition where the tear glands don't produce enough of the watery component of tears, most commonly due to the dog's own immune system attacking the tear-producing tissue. Though medications, certain systemic diseases, trauma, and congenital factors can also play a role. Certain breeds, particularly Cocker Spaniels and a number of brachycephalic breeds, are significantly more predisposed to developing this condition. The key signs to watch for are thick, persistent, mucoid eye discharge, redness, squinting, and a dull or cloudy appearance to the eye. Diagnosis is straightforward through the Schirmer tear test combined with a thorough eye examination. And while KCS is typically a lifelong condition requiring ongoing management, the vast majority of dogs respond really well to consistent treatment with immune-modulating eye medications like cyclosporine or tacrolimus, alongside artificial tear supplementation, and go on to maintain good comfort and vision throughout their lives. For that small percentage of dogs who don't respond adequately to medical management, surgical options like parotid duct transposition can provide an effective alternative to preserve long-term eye comfort and function. If your dog is showing any of the signs we've talked about today, that persistent thick discharge, red or irritated-looking eyes, or excessive squinting or pawing at the face, please don't wait it out or assume it'll resolve on its own. Get them in to see your vet for a proper eye examination and a Schirmer tear test. And if you own one of those higher-risk breeds, even without obvious symptoms yet, it's really worth asking about including this simple test as part of their regular annual checkup, because catching this early truly does make all the difference in protecting your dog's long-term vision and comfort. Alright guys, that's it for today's video on dry eye in dogs. If you found this helpful, please give it a thumbs up, hit that subscribe button if you haven't already, and let me know in the comments if your dog has ever dealt with KCS, or if you've got questions about anything we covered today. I really do read through all of your comments, and honestly, a lot of the topics I cover in future videos come directly from questions you all ask down there. Thanks so much for watching, take good care of your dogs, and I'll see you all in the next one.